questions?
We've got answers.
Tune in Tuesdays at 12 on Facebook Live and Instagram Live, where we will be hosting a variety of community experts that will answer your questions.
Hi, it's Brooke Laster, Behavioral Health Clinician at Summit Medical Group. Join me as we talk about ways to better manage pain after breast cancer treatment.
Hi, everyone. It's Jillian.
And Michelle.
And welcome to Tip Tuesday, where, we bring together topics and experts to help support and empower the survivor and metastatic community. So, we do want to say if there's ever a topic that you want to talk about or it's important to you and you think will help support our community, please let us know. Just drop the comment in and say, hey, I really want to talk about this. And we promise we're going to get you an expert to talk about it. So, today we wanted to talk about chronic pain, but pain that's long after initial treatment. It really is an issue for so many of us. And we want to talk about how to deal with it. And we are so happy, and I mean happy, ecstatic, so excited to have with us today someone who was so instrumental in getting so many of us, including me, over so many humps. And many of you in the community know her and love her. Her name is Brooke Laster. She is a behavioral health clinician and she works now over at Summit Medical Group. She works with pain management, the neuroscience team. And I can't wait to get to you, Brooke. I just have to see if Michelle needs to add anything in, but oh my gosh, we're so excited to talk to you today. So thank you for taking time out of your busy schedule to be here. We love you.
Yeah, absolutely, Brooke. It's so good to see you again.
Only this time I'm not laying like this. So you know
Okay. But before we start, I do want to reach out to our community and ask, because Jill and I and our mission is to reach as many survivors and fighters and supporters as possible. And it would be really helpful if all of you out there would like to follow and like and invite your friends to all of our social platforms, because at the end of the day, it's all about algorithms. And the more touches we have, the greater our reach can be. And I think Jillian and I are going to put together a little video on how to invite your friends on Facebook, just to make it easier. So please look for that and please share us with your people. We'd appreciate that.
Awesome. Are you ready, Michelle?
I am so ready.
All right, let's ask Brooke. Yay. All right, Brooke, we have a lot of questions and they're in depth because pain is an in-depth subject, obviously. So I want to start with, many breast cancer survivors and metastatic are living with chronic pain post-treatment due to several things. And we talked about this: neuropathy, pain associated with the aromatase
inhibitors. Yeah.
Thank you. Other types of pain related to ongoing treatment and the disease. So what can we do to bring down the intensity of that pain that so many of us experience?
Yeah. Well, first I have to say, I'm so excited to be here and I love seeing you ladies. So I just have to put that out there and back to me with you guys today. So one of the first things to think about when we're considering chronic pain post-treatment or even in the metastatic setting is, first and foremost, you always want to be checking in with your doc, right? Any new sensation signals going on in your body that weren't there, that don't feel right, that are concerning, speak up, right? Speak up, advocate for yourself, make sure that you're figuring out either what's the cause of this, or if there is no known cause, then we can kind of work through it. Even if there is a known cause like neuropathy or maybe some of the arthralgias related to aromatase inhibitors, making sure that your doc is aware of that, right? So that's kind of step one. If you're dismissed, that's another good important point, right? To always make sure that, even if you're being told that this isn't something to be concerned about, it's still bothering you, speak up, right? It's okay. It's hard to recognize what's right or wrong in your body post-treatment or in the metastatic setting because your body doesn't feel like it once did, right? So it's going to be difficult to kind of understand that. So how to bring down the intensity, right? So what do we know about pain? So I might nerd out a little bit here.
No, we love it. Be a nerd. You're like this amazing. Go. I love it.
I've done this like deep dive in like this neuroscience pain world. It's also very interesting. So I get very excited. But what we know about pain is that pain is protective, right? Pain is really our brain and body's way of alerting us that something's wrong, right? It needs attention. And very often, you put your hand on the stove, right? It hurts. Brain says, pull your hand off the stove. That's protective. It's preventing you from getting a burn. Here's the thing. Sometimes pain is not necessarily dangerous, right? So this idea that hurt and harm are not the same. Just because something hurts doesn't necessarily mean that it's harmful. And that's a big, kind of concept, I think, to get our heads around. How could something hurt and not be harmful? When we're dealing with a post-treatment setting, you've just been through a lot of treatment and a lot of trauma, right? So it's been a really difficult time where your body's been put through a lot. So your body is overly sensitive at this point, and you're kind of in that stress response, right? So, everything that is happening might feel extremely dangerous and frightening. But the reality is a lot of the things that you're feeling may not be dangerous or harmful. They might just feel that way.
I love that you said that, because I think so many of us in the community, that hurt versus harm, our bodies are all so different, even years down the line. And there's this panic when you have a prolonged pain. And then you rush and you get all like MRIs, you get everything you could possibly get for them to come back and say, yo, you have arthritis, calm down. But our mindset is that pain is something horrific. Mm-hmm. So I love that you said, be your own advocate, really push, and that it's not always an indicator of massive trouble. It could be just an indicator of, listen, this is your body's going under different things now. It's a new self. Yeah. Michelle called it a now self. Like, this is your now self.
Yeah. Right. None of that new normal stuff, right? This is your now self. I like that.
Yeah.
And right. And so when you're in this space, this now self, your nervous system is going to be highly sensitive. It's overprotective, and rightfully so. This is biology at work, right? So your brain is going to be scanning the environment, looking for threats, for potential danger, because you've just went through something really dangerous, something life-threatening, something terrifying. So it's going to take a little while for your body to kind of return to more of a calm state, mm-hmm. right? Where that stress response gets turned off. But that's not going to happen right away.
Well, that leads me to, there is a big, by the way, a lot of people are saying hi to you, Brooke, because of course we all love you, know you from Valley. Just to get, I want to get back to questions, just to give you an idea of Brooke's character and how amazing she is and how much she cares. Can't tell you how many times I might have had an appointment and I walked in the building and Brooke might get a 15-minute walking lunch and I'm all going in for an appointment. It's maybe 3 years after cancer. She's like, how you doing? And I'm like, I'm a mess. And I would just break down. She'd be like, all right, come sit. I'll eat my sandwich and talk to you until I have to go. Like you care so much, and that means the world to all of us. So you are so well loved and respected in our community because you give so much of yourself. You are. Thank you. Thank you.
You all make it easy.
Well, we love pleasure. You. Yeah. And it kind of leads me to one of the things that I really struggled with that you helped me with, but it's a common thread in our community. And that is the anxiety, that rips us to shreds, like not only during, but really long after. And is it normal to have that? And can that anxiety accelerate unusual pain?
So absolutely, right? 100%. Stress, anxiety, and pain are certainly correlated. If I ask patients, how do you feel when you're stressed, when you're anxious, what do they describe? I feel tense, right? That muscle tension. So when we're tensing our body, what tends to happen to our pain experience? It ratchets up, right? So and the anxiety post-treatment is very real. Again, kind of going back to that idea of you've just gone through something very traumatizing, something very frightening. And so your body's going to be in this kind of perpetual stress response. What we want to do is become aware of that, but also, addressing some of the concerns that do pop up physically you do need a little bit of reassurance at first. We do need to have some of those restorative experiences where most likely what you're feeling is normal, right? Because leading up to this, what happened to you wasn't so normal, right? It was that worst case scenario. So I would often joke with patients, that you kind of have full license to be a bit of a hypochondriac at first, right? It's okay to call your doctor. It's okay to, ask them what's going on and have them tell you that this is normal, or hey, why don't you come in and let's do a quick checkup. As you have some more of those experiences, that idea of whatever you're feeling is most likely not something life-threatening or extremely dangerous will come, right? That may become more of that default. But to that end, with the anxiety that you're experiencing, even though that stress response is heightened because of the trauma that you've just been through, the kind of neat thing is we can turn on a calming response, or the relaxation response, I like to call it, in our body. And there's a couple ways that you can do that from a physical standpoint and from more of like the psychosocial standpoint. So we can talk a little bit about that.
Yeah, I would love to, because really what I wanted to ask you is next, and it's not just the emotional, but I think it is also the physical, is how do we get back to life and emotionally, physically, and create a space that feels good in the now self?
Yeah. So how do we get back there? I would say the first place to start is with some grace and compassion for yourself and what you've just been through, right? In the way that you would talk to a dear friend or a loved one who's just gone through something difficult. How about talking to ourselves in that way? How about talking to yourself in that way, right? Wow, this has been a really hard year or two. Give yourself some time, give yourself some space, that you may never be who you once were. And how could you be, right? Given everything that you've gone through, but that you're still you, and that will come in time. So giving yourself that time and space, and there's something to be said about that. You're right where you need to be. And that's when we can then move to a little bit of acceptance, right? I've just gone through all of this. This has been a really tough road. I'm different. I don't like this, right? I don't want to be in this realm, but here I am. When that acceptance comes through, that then opens the door to kind of, okay, what next, right? And that's the connecting with, who is it that you were, or what is it that you want to get back to doing? And so a biggie is connecting with others, right? And I know with your, forum that you guys have created here, with support groups, with different online platforms that are available now, having that connection in that space to, talk about how hard this can be is really important. You're giving yourself that opportunity to kind of process the emotions. And once you do that, they're no longer stuck here, right? It's so important to talk with others, especially those that have been there.
Do you find that a lot of survivors and fighters say to you, I find this fascinating, because I think I did it for a few years with you, where you're like, I'm sorry. Like, we're apologizing because we feel bad. Yeah. And we're like, are we crazy? Like, we feel like, I'm sorry, I'm bothering. Like you want someone to pay full attention to you, but then the whole other world in this cancer community is going through the same thing. So we end up apologizing constantly for how we feel, which I think then adds more stress to the situation.
Yeah, absolutely. Right. So there's this feeling that, I should be better by now, right? I shouldn't have all these problems still. But should you, right? Why should you, right? What have you just gone through? It's more of a preference, right? You'd prefer that you weren't sitting where you are right now, right? You'd prefer that you didn't have to have gone through everything or still feeling the way you feel. So how we talk to ourselves matters, right? Language matters, not just with others, but even with ourselves. When we're telling ourselves, I should be further along at this point, or I should be feeling better, kind of catching ourselves in that language, right? I would prefer that I'm feeling better. And, again, how would I talk to somebody else, right? If somebody came up to you and said, oh, Jill, like, gosh, this neuropathy, and it's been 2 years, and I'm sorry that I'm bothering you with this. What would you say to them, right? You'd say, oh my gosh, take a seat next to me.
Right. You wouldn't
Been
be
there.
like, oh my God, you're a hypochondriac, calm down.
Right.
I think what a lot of people don't realize, I mean, yes, our community realizes, but we also get supporters that watch, is that, and to help support their loved ones and friends, is that there is so much pain long haul, and that these drugs that we take, I took a short round, I refuse, everybody's different, Brooke, we have this conversation, but they cause things like your feet, you can't even get out of bed. You try to stand on your feet and it feels like there's knives going through your feet. And this daily, it takes its toll on us emotionally. And I think if we could, I want to get down more into the actual management of the pain. Like when someone comes to you, Brooke, and says, I'm in so much pain 24/7 for all these different reasons. I know Victoria talked about even radiation pain and scarring left behind. And there's always something that's going to cause this pain.
Yeah.
Can you walk us through, ways to cope? I know you said support group. When do you know, okay, I need to go get medical attention for this.
Yeah,
I need
yeah.
CBD. I need this, I need that. Can you walk us through some more resourcey?
Absolutely. Yeah. So support group is just always for anybody that's gone through this, but that's not, how's that going to affect your pain, right? So having that connection is obviously comforting and that feels good. But day to day, when you're experiencing these pain flares, what to do? Our tendency is to give all of our attention to these pain flares because our brain is telling us so, right? Something's wrong. And so we're going to attend to that pain with some emotion, right? And it tends to be fear or frustration, right? And so then it ratchets it up further. The whole idea here is that even if you can't eliminate the pain completely, can you turn the volume down on the pain? And so part of doing that is not just ignoring the pain, right? Because it's impossible to do that. But can you identify another part that does feel good? I'm a big fan of just plain and simple deep belly breathing. So sometimes this can just sound a little too simplistic, but it's actually a little bit more involved than just kind of taking a deep breath. When we're engaging in deep belly breathing, we're actually turning on that calming response in our nervous system, which then does what? It can quiet down that stress response that's keeping some of these, negative emotions and fears going. So if we're engaging in deep belly breathing, that's helping us to pay attention to what does feel good in our body. We only have a finite amount of attention in our brains. And so when something's negative and all of our attention's going there, it's going to be very loud. If we're paying attention to something else in our body, like our breath, the pain's still there, but it's just not as loud. We have something else that we're paying attention to authentically that balances it out, if that makes some sense. So things like that. And I'm a huge fan of deep belly breathing. And to springboard off of that, things like a meditation practice. There's so many great apps out there. I'm sure you've seen commercials for things like Calm and Headspace. And I could always somehow get you I have a list of resources that I love to share with patients. And it's just kind of developing this toolbox of strategies that work well for you, but it takes a lot of practice.
I love that you just said that, because I think that's what it is. Because I think what happens is we tend to run, I think, you tell me, it's a balance, right? Mm-hmm. So yes, you go to your doctor, they're going to give you something for the pain, but you don't want to live dependently on that there should be, and this is what you do. You work with the neuroscience of pain, because pain really is controlled in the mind. It's just hard to tell the body that, right? When we're in it, we're like, just give me something.
Yeah.
But you're saying it's a whole toolbox that you have to put together.
Right. The pain traditionally, up until recent years, has been looked at strictly as a biomedical problem, but it's not, right? That's only part of it. So your doctor is a great place to start. And there's tons of great interventions out there between injections and medications. Even topicals, things like CBD can be incredibly helpful, but that's a piece of the greater puzzle. Attending to the psychological piece of it and even the social piece of it. It's this three-pronged approach that you're going to have the best outcome in terms of pain management.
I love that, because it's a toolbox. It's what you said. And I want to address something that Dina, who is actually our acting president and beautiful self, our board president. And you know, Dina, we love Miss Dina. And she's saying, because Dina is metastatic, and she's saying that, you know, she feels the drugs and everything has aged her so much, which it, you know, it does. Let's face it, we've all been, you know, it is what it is physically in the last 2 years, and her body pain is ongoing. So if she doesn't have pain some days, that's a trigger to make her think something's wrong, because it's a different response. And she's like, I know I need to work on that. So does that happen too, where if we're so comfortable, it's almost to me like a bad relationship. You're so comfortable in a bad relationship that if you meet a nice guy, you're like, oh, no. Hey.
It's so true. You know, one of the things that I'll often say to patients, you know, when you don't feel pain, what happens? Well, I get scared, right? The pain becomes so comfortable, so familiar. It's like this default setting, right? That when we're not with it, we're either anticipating that it's going to come back, or we're searching for it, right? Where did it go? When's it going to pop up again? And then we're bracing ourselves, right? We're waiting for it. And so it's this sort of funny thing that goes on, right? Like with the bad relationship, like what do I, you know, and being able to address, you know, this idea that I can effectively self-manage this, but that it's going to take practice and persistence, and it's not going to change overnight, and it might not change dramatically, right? But even just the idea of being able to turn the volume down to a degree where you're more functional, because that's the other piece. The more we're avoiding, the more we're withdrawing, that increases debility, right? And it also increases symptoms of depression and things like that. So the idea with chronic pain, which is interesting, is we actually want to do more to desensitize the body, versus traditional acute pain is rest, heal, and get back to living. In this way, it's sort of the opposite approach, right? What can I start doing more of? And basically telling my body that I'm safe, I'm okay, that this pain is not necessarily dangerous. It's incredibly just comforting, right? But that I can manage it in these ways, right?
Would you say if somebody hasn't had a lot, if they're experiencing physical pain and it's chronic, and you know, that they should seek out someone like yourself, like a, you know, with what you do, someone who works like a behavioral clinician?
Yeah. So find yourself a good therapist. And, you know, sometimes therapists may not have a background in chronic pain necessarily, but they can certainly get curious with you. And again, I don't know if there's a way for me to share some resources with you, but I have, there's a pain management workbook that is like my go-to. It's a really easy format to use. And so, you know, you could even get this book, give it to your therapist, and so let's work on this together. These are cognitive behavioral therapy strategies, relaxation strategies that you can work through. And again, begin to build that toolbox that you have, because this isn't easy to do on your own, and you shouldn't do it on your own, right? We weren't meant to walk through this life alone. And especially with these types of challenges, you need a coach, you need somebody who's guiding you and keeping you on task and encouraging you.
I can't tell you how much love you have. Karen Rain is like, oh my God, it's so wonderful to see Brooke. Everyone loves seeing you. Everyone, Morale, everybody is so happy to see you. You get lots of hearts.
Brooke was the first person when I went to with you, Jill, to see your counselor or therapist, who validated what we do at Beautiful Self and who we are. You were the first professional with letters behind your name who said, this is what you guys do makes a difference.
It makes such a difference.
Many years ago. So
no, the work that you guys have done is life-changing, literally life-changing. And I mean, I would always tell Jill, whenever I would have a patient come through and tell me that they had their shoot, the joy, I mean, the elation on their face, and you could just tell what a transformative opportunity you gave them.
Wow.
So thank you.
It's definitely, it's a community, and that's the beautiful thing about this awful dis-ease. So I want to ask you one question before we recap and and say goodbye, because that half hour goes so fast.
I
know. And we know that pain causes anxiety. We know that. But does anxiety cause pain?
Mm.
I know that's a reverse.
Yeah. Well, yeah, as I said earlier, right? When you feel anxious, what happens in your body, right? So we tense up, our heart starts beating faster, right? That stress response kicks in. So that in and of itself are going to get some of those stress hormones going. And so it's going to make pain feel worse, right? So does it cause pain? Not necessarily, but does anxiety make pain feel worse? Absolutely.
Okay.
Yeah.
So what I'm taking away from today, and is that number one, you have to be your own advocate.
Yeah.
Number two, you're not crazy. You've been through hell and back.
Yeah.
You're allowed to
and your
feel
pain
this
is
way.
real, right? Your pain is 100% real because you feel it.
Oh, thank you for acknowledging that. That's
Yeah.
amazing. And that it's a different treatment, because acute pain is you rest, you do what you have to do, you get over it. Chronic pain is not just take a pill, you're done.
Right.
You need to seek out help. You need to seek out someone like yourself. You need to see a therapist, and that you have to start learning to integrate and to put it all together so you can have a productive lifestyle and learn to manage.
Yeah,
is what you're saying.
Absolutely, right? So it's the biopsychosocial, right? So it's the doctors, it's the medical interventions, it's having the psychological support, working through some of the fear associated with the pain, the frustration, finding a great therapist or group, and then having that social support, but also the active part of it, right? Getting moving again, getting going again, doing the things that you were avoiding, and maybe getting creative about how to re-engage in some of that despite the pain, and turning that volume down.
I think the first step is probably the hardest.
Yeah.
It's of anything, whether you're deciding to go on a diet, whether you're getting over a divorce, whether you're whatever it might be, it's your first days out of initial treatment, and you're kind of out in the world now, and you're not having those weekly doctor appointments. That first step of anything is the hardest. And I hear you. You're saying, take it, get the help. It's a big 360 approach.
Yeah. And giving yourself that grace and compassion, right? Some of that self-love, although I know that can be a little much for some, but the way that you would support and love, your fellow survivors or others that you're connecting with, give that to yourself a little bit. Start there.
Okay. You're amazing. And if you give us,
you're amazing.
No, you're amazing. I'll do this all day. So if you give us the book, the list of resources, we will absolutely publish that, not only in this chat, but on our website.
Fantastic.
And I know that you were back to back today, Brooke, with your clients who need you. So I can't begin to tell you how much we appreciate it, how much love you have in the chat, how fantastic you are. And thank you so much for everything you do for the community, just who you are as an individual, and for jumping in on this conversation. We adore you.
Thank you so much for having me. It was my honor. I was so happy to see you both, and to see, everybody else that's out there. Hi, and keep doing the great work you're doing and taking good care of yourselves.
Thanks, Brooke. We'll be in touch, and we're going to get all that information from you. And you know what? As always, just a reminder to everybody, as we always like to say, stay strong, stay positive. You are beautiful. You got this. And we'll talk to you next week. Brooke, we love you. Mwah.
Love you, Brooke.
Thank you.
Thank you.
Bye. Bye, everyone.